Hello and welcome back to On Air with Dr. Pete. I'm your host, Dr. Pete Economo, and today we are thinking about all things personality. And so you may have heard about personality, but this is a new type of personality called the Otrovert. And we wanted to get the expert here. So we got Dr. Shannon Sauer-Zavala. And so Dr. Shannon is a clinical licensed psychologist and associate professor of psychology at the University of Kentucky and the creator of BPD Compass, which we're going to spell that out for you in a minute, and the founder of Compass Mental Health Training and Consulting. So she is an expert in all of these types of things. And so we are so happy to have you here. Thank you for being here.
Yeah, thanks so much for having me, Dr. P.
Happy to. Yeah, it's awesome. And Kentucky. So this is, we have a lot to talk about. I told you that. So tell us a bit about your background. Like, how did you even get into this?
Yeah, absolutely. So I am as a clinical psychologist, like you said, and my focus for a long time has been doing treatment outcome research. So my goal really is to make treatment, evidence-based treatment that's proven in clinical trials that works, accessible to more people, not just wealthy people. And so that's kind of like my main overarching vibe. And the way that I got interested in personality is because kind of behind the scenes in personality research land, there's all this data that suggests that you can really understand most common mental health conditions as vulnerabilities in these personality dimensions, right? Yeah. So people that are high in what we call neuroticism, or the tendency to experience negative emotions, they are more likely to experience anxiety, depression, eating disorders. Yeah. People that are low in conscientiousness are more prone to have difficulties with substance use or to have ADHD. Mm-hmm. And for me, as a person that wants to make evidence-based treatment more simple so that therapists in practice are more likely to use it, I got interested in developing treatments to target personality traits instead of like playing whack-a-mole with the different symptoms. Also, because most people that we work with have more than one condition. So it's just more efficient to target the vulnerability risk factors rather than to target each symptom or disorder separately.
I love that. And I think, so if there's anyone listening that is, like us, like actual psychologists or in this field, personality assessment, for example, gets a lot of negative, media, if you will. I was just trying to make that G-rated so I didn't have to like click any curses on here. But, right? Like, don't you, like, so like I was trained in like the TAT and Rorschach, which, are we even using those anymore?
Not really, no. So I think it's kind of worth talking a little bit about personality assessment.
Yes.
And so, most people that are listening are probably familiar with like Myers-Briggs or Enneagram or DISC, right? These are things that they've probably had to take in their HR department, right? And those are not the tests that we use in our research studies, where we're trying to understand what personality is, how it changes over time naturally, how it changes in response to treatment. These are like, like corporations that are selling personality tests to other corporations. And in fact, they're not, when they have been studied independently, they don't do what they're supposed to do. They're not reliable. So different times that you take them, you could get a different like type.
Correct.
And what I think is even more concerning, because workplaces make hiring decisions, make placement decisions based on these tests. They don't actually predict career success. They're about as good at predicting your career success as your zodiac sign. Right. So definitely take Myers-Briggs, Enneagram with a grain of salt. The measures that we use in our research studies, this is where I kind of think like clinical psychology or clinical psychology research needs a PR person, because, the model of personality with by far the most research support that's been studied for over 100 years is called the Big Five.
Yes.
And, it's 5 traits, right? Psychologists aren't really that creative.
We're not creative, and we're not good at PR.
Yeah, not really, or at least not on the research side, right? Yeah. We're not.
I mean, look, that's truth. Because what annoys me about this, sorry, I have to go here for a second. What annoys me is like, we talk about, say, like tenure, and you and I can maybe talk about that for a little bit, but do we, dissemination is a piece of that, but like how many can really go on to like, CNN and talk well about their research? How are you actually disseminating? Because if you don't have media training or understand how to like you're like, just like you're about to do, so the big five, we're going to break that down for people to understand that what you're taking at work is unlikely anything that's actually, like you said, your zodiac sign is more predictive. So HR companies hear that. But go ahead. So the big five.
Yeah, yeah. I mean, and I think like, just to kind of go off of what you just said, I think dissemination is, I mean, it's just so important. And,
Yes.
it's great that like that you have this platform where you're, where we are kind of talking about the science. I mean, for that very reason, me, like, I don't know, like a nerdy academic in my 40s, like I have an Instagram. I literally make reels about like, and get on my soapbox about personality testing because
Yes.
I have clients come into my office and say, I'm an
I
ENFJ.
know.
So
Yeah.
I just couldn't possibly like be
Yeah.
assertive in this particular relationship. It's
Yeah.
like, well, first of all, that test is not
Right.
predictive of results. And also it's so self-limiting.
Yes. Amen. All right. So big five is at the core of your research, would you say?
Yeah, for sure. For
Okay.
sure.
All
So,
right.
so Big Five, it's actually, I mean, if you're a personality nerd like me, it's really interesting how we sort of settled on these traits.
I
So
know.
basically, in the 1930s, so nearly 100 years ago, psychologists combed through the dictionary and pulled out any words that
How would
describe.
the IRB like that today?
I mean, that'd probably be fine, right? Because it's not a human subject.
Yes,
But
except that you have to have some theory to like back up your research. Like if you're just wanting to taste, test like purple lollipops, you can't do that. The IRB is gonna say, well, you can't give them the purple because there's no foundation to why you're going to study that. But I hear you. So dictionary comes out, they pull these five words out.
well, they pull all thousands of words,
Okay.
any word that describes human nature, and
Right.
then they try to group them in smaller and smaller categories. And they keep reducing and they keep reducing until they get to these five overarching traits
Yeah.
that can kind of explain all the differences across people and can't be reduced anymore. And so the traits are neuroticism, which is the tendency to experience negative emotions
Yep.
frequently and intensely. Agreeableness, which
Mhm.
is how well we get along with other people, how trusting we are,
Yeah.
how genuine we are. Extroversion, which most people think it has everything to do with sociability, which it
Right.
does to a degree, but it's actually broader than that. It's about like energy and excitement
Mhm.
and being social. Life of the party is kind of just part of that. Conscientiousness, which is the degree to which you're reliable, achievement striving, organized. There's tons of data that suggests that people that are higher in conscientiousness live longer, they make more money,
Yeah.
because they're probably following through with their preventive medical care.
Yeah.
And then finally, openness, which is just how open you are to new ideas and experiences and aesthetics.
Love that. So, listeners, also, I love that you could tell that you're an expert in this because you went backwards. I always go ocean.
Oh.
So for the acronym, so for us less smart people like myself, we do there. But ocean. So yeah. So those are the five there. So you've really simplified. That's great. But in your characteristic way of thinking, feeling, and behaving, do you believe that we have the ability to change our personality? Like what would you say about that when people hear that through the course of lifetime? How does personality change?
Yeah, great question. Yeah, it does.
Yeah.
And it does quite a bit. So there's a big period of personality change from like 18 to 30. And I
Yeah.
think that that's a really important time because that's when people are leaving home. So
Mhm.
they're getting to choose their environments, and your environment can really, and how you respond to it and how it responds to you. Can really drive some of that personality change. But then, I mean, it definitely changes into adulthood. And,
Yeah.
and the way that I can make that claim is, we've tracked tens of thousands of people in longitudinal studies for decades.
Wow.
And so there's really, really robust data that suggests that personality changes just across the lifespan. Now, importantly, there's a lot of variability. So some people change a ton and some people are more stable.
Do we know why?
Mm-mm.
No.
No.
Oh,
But what I've been working on for the past 10 years or so is like volitional personality change or
Mm,
intentional personality change. And so rather than just kind of like going with the flow of life, you can actually nudge your personality in a direction that will be more in line with your goals and values,
hmm
by taking particular intentional actions. And so we can see, like, in terms of like effect sizes, which is like how much change,
hmm
20 years worth of naturalistic personality change in about 20 weeks.
Wow, for real?
Yeah, for
That
real.
that is that's pretty like wow. I mean, because I think people are they're so stuck on their personality where they're like, this is who I am. It's making me think. We did an episode on divorce and how around perimenopause divorce is increasing. So overall divorce is decreasing. But then in this one specific age group, especially for women, they're like initiating this divorce at a certain point. I'm thinking that also people are feeling like it's because that person changed, thinking about like relationships and how, so how would you like clinically work on that? If someone's personality is shifting, but their partner's like, I don't like this new personality.
Yeah, yeah. Well, if I was working with the person who was shifting, I would try to get a sense of like their goals and values related to that,
Yeah.
and is this shift in a healthy direction for them
Yeah.
or not, right? So
Yeah.
so I think that can be a little bit tough to think about. Is it adaptive for them to go back to the way that they were or not?
Yeah.
Um,
Wait,
a
so,
lot of times,
I'm
like
sorry.
naturalistic personality change usually is in a healthier direction.
I would hope so. Well, oh, that's interesting.
Yeah.
Because obviously there's going to be people who go in all directions, but you say in general it's more in a healthy direction.
People tend to become more emotionally stable. They tend
Yeah.
to be more, more assertive.
Yeah.
They tend to be more conscientious over time. And like, contrary to what you would think, as people age, they tend to become more open.
Yeah. Actually, I would believe. Well, I guess it's because what we do for a living, but because you also don't care as much, too, right? I think
Well,
it's so. That's like so for adolescents that might be listening, like it will get better, as you become more conscientious and open. Wait, going back to the Big Five really quick because I don't think I ended that. Which is,
yeah.
do you want to share which assessment you use that you feel most comfortable with in your research?
Sure, sure.
Okay.
So there are a bunch of like five factor model or big five tests that cost money that you can take
Yeah.
online. I have a free version on my website.
Wow.
It's called Personality Compass Assessment,
Oh yeah.
and basically, like, it's free, and it's because I am, in a fight with the commercial personality testing industry.
Love
So
it.
I really want people to be able to get
Disrupting.
yeah, science based, yeah, to the like 300 people that come to my website and let them disrupting.
No, we're gonna get it out there. It is in the show notes. That is so good. Yeah. Well,
Yeah.
yeah. It's I love that. So that's like a real social justice component to your work too. I'm gonna call it that. So
Sure. Yeah, I'll take it. That's a compliment. I'll take
it's well, and it's true because this stuff you also opened that way. You said you wanted things to be less expensive, and the rich will get all the treatment that you want. And if it is personality based, we need the right people out there giving them the modalities that work. You
Right.
know, yeah. So I love that for you. And I actually, so what's coming to mind for me is I have a paper coming out about, we took about 5,000 NFL combine athletes. So from the 80s, similar to the 30s when they were going through the dictionary. In the 80s, a colleague of mine just went through um, the international database of personality tests, like IAPA or I. You probably know what I'm talking about, but I forget the
Yeah.
actual acronym. But there's like this website that has all of the personality items on it, and so he went through and just developed his own test. And so we did the psychometrics on it. We had a biostat, all that type of stuff to see if it was actually reliable and valid and all that types. So it's curious to see this because I'm all of that long answer to say in sports and performance, we are trying to predict right who could be a good draft and
Mm-hmm.
and what's a successful draft. HR is doing it because of whatever they're doing it for, and I don't want to talk stuff about that, but you know um uh, sports organizations are spending millions and millions of dollars on a draft, and so they want to see and so what we've been wrestling around is like, what is success? Is it a second contract? Is it a Super Bowl ring? Like, what actually defines success? And so to your point, even with these personality assessments, like what's the outcome? What are you looking to understand about this? Is that what? So like, how do you help people even interpret some of the results?
I mean, that's a really great question. And I think, like, I mean, I'm happy to put HR on blast. It's just to say that, I mean, this is just for listeners, right?
Sure.
You are, if your employer is giving you a personality test, it's not because they want you to self-actualize, right?
Yes.
It's for the bottom line, obviously.
Yes.
So otherwise, why would they do it?
Amen.
And so I think that's a really nice segue into like how do we use this information as
Yes.
individuals when
Yes.
you get personality test results.
Yeah.
And so, the prevailing wisdom, right, when you take take one of these 16 personalities tests, you get a type and you're supposed to choose your career based on your type. You
Yeah.
great in this role, or, this is the partner that you should have based on this type. And so, for the personality test that's on my website, I really tried to like create a score report that, of course, is like based in science and accurate, but also has kind of a growth mindset vibe, right?
Yeah.
So here are sort of the pros and cons of being at this level.
Love it.
I don't actually think that there's like an optimal level of any of these traits.
Right.
It is the level of the trait that's right for what's important to you.
That's it.
And so, like, I don't think that being an extrovert is like better than being an introvert, and like all the introverts should try to like nudge their personality.
Absolutely not.
But if you're a person who is more introverted, not super assertive, but you've got great ideas and you want to, you do want to move into a leadership position at work, like that's a place where you might want to nudge that trait a little bit. And
Yes.
so to your question of how do I work with people to figure out what kind of changes they want to make, we actually start with values, and really get a sense of like what's important to you, like how do you want to show up in these different domains of your life. And then we use the personality test to kind of determine if there are any of your traits or tendencies get in the way of living your life the way that you would want to. Because the strategies that we use to change personality, they're like actually like super simple, like ridiculously simple, but they're not easy. Because changing your behavior and your thinking is not easy. So you have to have really strong motivation, and doing it to do it isn't it.
You sound very third wavy, CBTE. So I love that. So we could definitely shout out to Hayes. So your TEDx, I listened to, heard that, and really looking at not allowing your personality to dictate who you become, and I love that. And that's what we're saying here, and I love that. So tell us about how that personally worked for you.
Yeah. So contrary to what many of my students or people that know me now would believe, I used to be really shy and really kind of a disorganized mess. And I didn't set out to change my personality. This is something that I started researching, in the last 10 years. But when I look back on my life, I can see some of the principles that I've, kind of capitalized on in my research happening for me. And so, I was the type of person who, like, in terms of my like lack of conscientiousness, is the type of person that would clean by stuffing things under the bed. I mean, this shocks people. I used to skip class so much in high school that I actually failed like algebra 2, and I had to retake it the following year. And that really continued when I went to college. However, I took this intro to psychology class just because I think my advisor was like, take this class. I was like, cool, sure. And even though it was at 8:00 in the morning, 3 times a week, and like based on how I was really conducting myself in college, I shouldn't have gone to it. I went to every course meeting. I think it was interesting to me. And so I was rewarded with that, right, by doing really well on the first test. And that's kind of like a rite of passage test, and a lot of people did really poorly. So the TA was like, oh, Shannon, you should consider majoring in psychology. And I was like, sure, cool, I'll do it. So because I really didn't have any direction, but I think like that positive reinforcement for doing something different, like it was a different approach than I had been using in my other classes, was enough. It was just enough to keep me, at least in my psychology lane, working hard, right? And so, I took more psychology classes and I did well. And so it also shaped how I thought about myself. Like, I'm good at psychology. And so really, like, this goes back to a CBT perspective, right? Because I mean, the scientific definition of personality is your characteristic way of thinking and behaving.
Yeah.
And what we target in cognitive behavioral therapy are your characteristic ways of thinking
Thinking
and
and
behaving.
behaving. Yeah.
And so changing a habit, right? Like studying, going to class in this case, right? Like
Yeah.
if that gets reinforced by the environment, then you're going to keep doing it, right? And that's going to have an effect on how you think about yourself. But
Absolutely.
if you go into things thinking, oh, I'm the type of person who needs the adrenaline of the last minute to get started, like you better believe you're going to wait till the night before. So you can kind of see this relationship between how I think about myself and what I do.
Yes. Where was that? Like, where did you do all your studies?
Yeah. So I'm from Connecticut originally. I went to college in Pennsylvania at Gettysburg College.
Yeah.
And then I did my PhD work at University of Kentucky, where I am now. My
Nice.
pre-doctoral internship at Duke, which is in fact actually a real conflict of interest for being a UK basketball fan.
It totally is.
It's a huge conflict of interest.
Yeah.
Did my postdoc at Boston University, and then when my mentor from graduate school retired, I took her tenure line, and we moved back to Kentucky.
Isn't that so cool? Yeah, that is really really neat. So yeah, all that. So you have the sports thing. I guess there would be some conscientiousness around your sports loyalties or whatnot.
Yeah.
So reducing barriers and intentionally cultivating traits that bring people closer to their values and goals. That's what we're saying. That's why you've said values a lot today. So I love the ACT sort of references, and we talk a lot about that on here. And so tell about So this is how you work with people to reframe their personality types. Then, and your example really highlights that really well, because I guess what I'm hearing is we are limited by it. And I think about that with, like, say, BPD. I can think of people who've come in the office. I've worked. I used to work with BPD because of DBT.
Yeah.
And so, but then you realize yeah, exactly. And then you realize that there's all different types of people who have different specialties. And shout out to our colleague Shireen Rizvi, and just like really studying sort of the word.
Green.
Yeah, that's my girl. So, but like I've had people that come in and they're like, I'm BPD, and by first session, I'm like, but you're so attached to that identity that actually, are you? Because you're not really meeting the criteria today, and you have the skills for it, so you're not anymore. So let's change the narrative, and that's where we do like some of the schema work. And so let's get into this Otrovert then, because that's how we started. So go tell us about this.
So I think I read a news article about the Otrovert, and I was like, this is silly because it's nothing new, really. Like, the word is new, but personality exists on a continuum. And so, there are people who are at the very like low end of extroversion, so like pretty intense introverts. And then there are people who are like off the charts in extroversion, suck all the air out of the room, like interrupt people, right? And so we've got these two extremes, and most people are somewhere in the middle, depending on the situation. They're more extroverted, and they just kind of teeter back and forth. Exactly. That's why when people take the Myers-Briggs, they get different results every time, because most people are in the middle. So depending on the situation or the day, they're going to come out as an E or an I. And that's essentially, the Otrovert lives in the middle of that continuum. But everything to do with human nature, how empathetic you are, how fast you build on muscle mass, like all on a continuum. So the Otrovert is like a new word for most people.
You heard it here. Otrovert is the new word for most people. What we're describing is the normal curve, and how people fall right into those two standard deviations, right into that. And then also just thinking about middle path. Let's get another ACT shot out, in third wave. Like, always trying to find this blending of things. To have anything that polarized, like the world in which we live, it creates a lot of dysfunction.
Yeah. Right. And we see this in so many places in psychology. There's this, we're talking about it with personality, get a type, a box, right? There's such an urge to categorize things. We see that with different disorders. Oh, do you have GAD, or do you have social anxiety, or do you have BPD, or do you have depression, right? And actually, like, those barriers aren't, they're very permeable. And so people have symptoms of this and symptoms of that. And that's because categories it's superimposing a category system on something that isn't categorical.
Another theme of today, even for these personality traits, so what I'm hearing, and for what listeners is key, is like, you don't have to fit into a box. And I think just trying to like break out of boxes, understand yourself, the context, the context in which you behave. I love that you mentioned that. And the metaphor I use a lot with athletes is like, I'll be like, so do you dance in the middle of the circle, or you want to stay on the outside? And not everyone needs to dance in the middle, because there's not enough room for everybody then.
Yeah.
And in sports, unfortunately, some coaches really push athletes as thinking as if everyone needs to be in the middle, as if that quote unquote extrovert, but what we're saying is most of us are Otroverts.
Yeah.
And we could turn it on when we need to. And that's what
Yeah.
I'm hearing you say. Yeah.
Yeah. I mean, I'm actually thinking about, with your example with athletes. So my husband, he's an architect, but before he got licensed, he worked in like event design.
Cool.
And he was just working for like a corporation. And at his performance review, they were like, you really need to stand out more. You have to talk more in meetings.
Yeah.
You got to be the big idea person.
Yeah.
And so like, everyone got their performance reviews in like a particular week, and then they're all in the meeting and everyone's talking over each other because they gave everybody the same feedback.
Yeah. So that
doesn't work.
Really effective.
Yeah.
I know you're also on CBS Sunday Morning. They're saying that your research at the University of Kentucky is really a game changer, and really to approach, a way to approach mental health. And I think, so tell us more about that, because, the thing is, obviously, people say to me, like, what's this mental health thing? Like, why is it such a thing now? And it's like, yeah, I mean, 10, 15, I think you and I are probably the same age. And so we were trained around the same time. And especially like in the sports world, like, you weren't always around and accepted. Like, you were sort of down the hallway, and now like you're in the locker room. So we've created space to say, like, this is normal. Physical health is mental health. Yeah. But I love that you're thinking about really the vulnerabilities, getting at the core of this. And that's what I'm hearing. So is that how you would describe that, what you talked about on that show?
Yeah, for sure. Well, on CBS Sunday Morning, mostly I was talking about like how personality can change, because I was sort of backing up Olga Kazan, who's an Atlantic writer. She wrote this like super boss memoir about how she changed her personality by basically using CBT strategies. Yes. It's called Me But Better, and it's great, and everyone should buy it. She's hysterical. Yeah. But a lot of the game changer for mental health content got cut from the actual episode. No. But essentially, the idea, it's kind of like what I started with at the beginning, at the beginning of our conversation, which is that historically, we've thought about mental health conditions as categories. And essentially what that means is that there's a different treatment for every disorder in the book, being DSM. And that creates a huge burden for therapists, because in order to provide treatment the way it was developed and tested in clinical trials, you have to be up to speed on the nuanced differences between these different protocols, when really there's not that much difference in what is maintaining social anxiety versus panic versus generalized anxiety, right? Yeah. And so rather than focus on what's different about the disorders and giving them, putting them in a box and giving their respective treatment, my work has really focused on what is shared. And it's so much more efficient to target these shared vulnerabilities, because then you can see simultaneous symptom change across a range of different disorders, right? So it's really freeing for clinicians, because, most people are seeing folks with anxiety and depression, eating disorders, BPD, right? And, essentially that means that you could have one protocol and use it with most of your folks and, see benefit, right? And it makes good sense for comorbidity, because most patients have more than one condition. It's like the rule, not the exception. And so a treatment that's targeting what is shared just makes a lot more sense.
One thing I just keep thinking about, and we have to wrap this up. We're already almost done, which is so annoying because I have so many more questions. But because I'm thinking about narcissistic personality disorder, that is the one, disorder that I think is really important to get to a specialist. Yeah, and I'm finding a hard way of like wrapping my head around that sort of compass treatment for that disorder specifically.
Yeah. And so, I can talk a little bit about I mean, it depends if it's like a grandiose narcissist or
That's
a
the one I'm talking about.
narcissist like that. There's kind of a difference there.
Yeah, I'm
But
I'm talking about the grandiose one.
grandiose, yeah.
Mm,
So those folks are low on agreeableness, right?
yeah.
So they ping on that antagonism dimension, and that's actually something that we target in Compass because
Okay.
it's a vulnerability for BPD, also for borderline personality
Sure.
disorder. It just manifests a little bit differently. Like BPD, it's like mistrust,
Yeah.
and so we actually worked with a colleague of mine, Josh Miller, at the University of Georgia, who's our antagonist specialist.
I love it.
And we added we tried to add into the treatment examples, and we really talk about like the long and short-term consequences of your choices and how are they serving you, right?
Yeah.
And so we added examples for the BPD examples are like you want a relationship, so you change yourself for the group, and in the short
Hmm.
term that makes you it's relief and you're fast friends, and in the long term it actually screws you because if they really knew the real me they wouldn't like me, so you get even more
Hmm.
insecure. And so some of the examples that we put in to get at more of that like narcissism, like just pure antagonism, like the need to correct people for minor
Hmm.
minor infractions or grammar, right?
Hmm.
In the short term, like what's your motivation? We try to be really like
Right.
non-judgmental about it, even though
We're
we
judging.
well when coming up with these examples, we tried to think like, what are the things that annoy us?
Yeah.
In
Yeah.
what,
Yeah.
not
Yeah.
necessarily in therapy, but like
Yeah. Yeah.
and so it's like the need to be right.
Yeah.
And usually if we're coming at that from a non-judgmental stance, it's like you just want people to see that you're valuable,
That's
right?
it.
That you
Yeah.
know things. It's not coming from a dark place where you're like idiots.
Yeah.
You're just trying to be seen, right?
Yeah.
But in the long term, does that take you closer to what you want? Like, how is that actually working for you? Like
Yeah.
this strategy. So we really come at it like behaviorally.
Yeah.
The
I
other
love it.
example that we have in there is like one upping. Oh, like
Oh
somebody's
yeah.
talking about their vacation. Oh, well,
Yeah.
I went, oh,
I
I
yeah.
know all about that.
Yeah. Yeah.
And does, why you do that in the short term, what you're getting out of it, but like how that is taking you farther from your values in the long term.
Such good work. Such good work that you're doing. Thank you. So, I mean, again, I think we could keep going, but how can listeners learn more about you?
Yeah. So probably the best way is to go to my website. It is www.personality-compass.com. And if you're interested in taking the personality test, it is literally, there's like a big blinking thing at the top of the at the top of the page. So you'll see that.
Okay.
And then, if you're interested in volitional personality change and want to work together, you'll see options for that on there as well. And then I'm on all the social medias.
I love it. So we'll have all those links will be in the show notes. So, Dr. Shannon, thank you so much for being here. This was really a great conversation, and
Oh, my pleasure.
can't wait to hear more about this research. And for those listening at home, thank you so much for tuning in. You're the reason that we're here and trying to spread the word. So please like, follow, and share. Everything's at officialdrpete.com. We'll be back here next week. So until then, spread a little kindness. Stay well.